Hi, my name is Jolijn Drost. I'm a psychologist and registered schema therapist. I work in the Netherlands at GGZ Rivierduinen Eetstoornissen Ursula, which basically is a highly specialized facility in the treatment of eating disorders. I work at the daycare center within our organization, where we treat people with long-lasting, complex eating disorders with a lot of comorbidity often as well. And I'm also involved in schema group therapy treatments in two groups that we offer at our facility. One group is a group for people with anorexia, bulimia, or OSFED, and the other group is for binge eating disorder. And today I've got the honor of sharing with you and going through the different stages that you will encounter when you apply group schema therapy. So the different stages in therapy and the challenges that you will encounter in each different stage. So I'd like to start with addressing the first stage, the forming stage. Okay, before I continue, I'd just like to mention that everything I'm going to speak about today and I'm going to say, I've written it all out in slides that you can, if you'd like them as a reference, you can send me an email at the end. I've put my email address at the end in the last slide that I'm going to show. So you don't have to write everything down while you're listening. You can just ask me, send me an email, and I will email them to you. Now I'd like to continue with this first stage in group therapy, the forming phase or orientation phase. So everyone is new, the group starts. It's the initial phase where group members have to, they get to know each other. There's a lot of uncertainty. Things are not safe yet. So if you look at what are people looking for in this stage, it's just structure, reassurance. There's often also still ambivalence about joining, ambivalence about, do I really want to give up my eating disorder? Although that remains throughout all the stages, the ambivalence, especially in this stage, you might find that people are still just, testing the waters. You might get, if you look at modes that you can come across in this stage particularly, and modes, for those not familiar with schema therapy, you could say that they are like current emotional states, different states, emotional states that you can be in. Which group therapy is, I think is ideal and fantastic because you see everything happening in your room. And so these emotional states are very accessible and visible in a group setting. So modes you might come across in this stage are the over-controller phase mode. So wanting to know exactly what is expected of them, knowing the rules, wanting everything. Can you write it down on paper so I can have it? Just checking things, but also compliant surrenderer. So, yeah, I'll just wait. You're the therapist. I'd like to, just do exactly what you want me to do. Be compliant, please you, please the others. You can also have that people are still, because there's still a lot of coping modes are active in this stage, because it is a stressful stage. It's scary. A lot of people being part of a group is stressful. There's a heightened level of anxiety. Am I going to fit in? Are they going to like me? Is my eating disorder, is it severe enough? Do people maybe think that I don't belong in this group? They're all a lot sicker. They look thinner. They look better. Will I be accepted? Am I in the right place? I'm going to do something really scary. I'd like some reassurance, and already know that this is actually going to help me. If you then look at schema, so that's at a deeper level. They're more vulnerabilities that they build up over life, the way they view themselves, the way they view the world, ideas, very strong and persistent ideas that they have about themselves. In this stage, the ones that you might see is, for example, so the social isolation, the anxiety to, am I going to be part of this group? Abandonment. I'm going to have to let these people go in the end. This is only temporary, so I'm not going to get attached to these people. I'm going to keep my distance. Mistrust, people who are thinking I'm just really scared. I don't know these people. I don't know if I can trust them. Just going to be a bit standoffish in the beginning. And a lot of defectiveness, shame, failure. I'm not good enough. I can't do it. Look at how pretty these people are, how successful, and I'm not sure I can do what they are doing. They're probably going to look down on me. As a therapist in this stage, to just manage all these feelings and providing them with what they need at this stage, you have to provide stability, predictability, have clear boundaries on when do you start, when do you finish, what are the rules in the group, and also to manage anxiety. You have to be a bit of a leader in this stage. So lead by example, but also take control over the sessions so that the anxiety doesn't rise too high. So be more active in structuring the session. You speak a bit more. You're more active in how you present yourself than in later stages. So that's the challenge for this stage, to manage the anxiety, the avoidance that might take place, and to model openness, warmth, validate the fear that people might have, normalize it, and help with subtitling, as I call it, some of the things that they might experience and might not have the words for it just yet, or might find it a bit scary to share that with the group at this stage. So then we move on to the next stage. So now we've come to the next stage, the phase of storming, conflict, and testing phase. So this is a phase where power struggles emerge, where boundaries are tested and dependence on the therapist is challenged. You find in this stage that tensions might arise around vulnerability, around competition for attention, competition for who is the perfect patient, or competition on who is the thinnest. And this can also be a stage where patients start to challenge some of maybe the previously made agreements on eating disorder behavior, or boundaries regarding weight gain, for example. These things might be challenged again in this stage. And modes that you can come across in this stage are, for example, angry child. Things are not fair. You want to kind of battle you. You're not hearing me enough. The therapy is maybe not working. It's not what I need. Also, demanding parent, having high standards. Punitive parent. You can also come across that mode in this stage. And if I already mentioned the demanding parents, also in schema terms, you can have the more unrelenting standards, failure, defectiveness, shame schemas that are activated, and also mistrust and abuse. And as a therapist, you're also challenged, are you safe? Are you going to set boundaries or not? Are you strong enough to handle me, to handle my problems, to handle the difficult sides of me as well? That maybe I'm also scared of myself to go and well, make contact with that side of myself, to investigate it a bit more, explore it. So this is also a stage where you can, well, besides the competition, you can see phenomena like splitting, silent resistance, indirect hostility. A lot of people with eating disorders, there's a lot of aggression I find with people with eating disorders, but often not very explicitly. It can be quite subtle and in tiny comments that are being made, which you do want to pick up on, especially in this stage, and address it. Also, this stage can be quite scary for some patients, being often in this with eating disorders that people also avoid conflict. They might have encountered in their past severe conflict or have never encountered conflict, like everything is avoided. So if there is then a bit of tension and conflict in the group, although some people might have modes that are actually quite activated, there might be others that are really scared in this stage. So you have to also, as a therapist, balance empathy and authority, have realistic limits that you set. And what I really like about schema therapy is that in this stage, you can also use the mode model to externalize the conflict and discuss it and explore what modes are now activated, what is happening, what is the vulnerability underneath that is actually activated. And that is not being seen now because of the more conflict that is more visible on the surface. So in this stage, you also want to be, well, provide new experiences for the people in the group so that they learn that if there is conflict, that it doesn't have to be a disaster. You can, if there's a healthy way to confrontate, to do confrontation in the group, this can also lead to really helpful and good things. And it doesn't have to escalate. It can also be a safe environment. It can reduce tension. It can make you feel more understood and actually enhance connection within the group and among each other. And for people who are used to just always, just looking for conflict and liking the confrontations, it's a safe strategy. For them, getting boundaries can be confusing, but also really nice. Knowing, it's safe enough here. This my aggression will be stopped. So after this stage, we go to the next one, which is the norming phase. So the norming phase, or cohesion and trust building phase, we see that they come to a stage where the group begins to establish norms, the cohesion in the group is strengthened, and you see the members start to support one another more and more. You also see that clients start to take more risks at this stage. More vulnerability is shown, more authenticity. There's more compassion, more mutual recognition is emerging, and just overall more connection. At this stage, also people start to show more their vulnerable child mode, and also they're activating and building their healthy adult mode. And what I didn't mention before, but what I tend to see with eating disorders is there is a group of patients that at the start already will have, if you use questionnaires like if you use the SMI, will already have a very high score on healthy adults. But in reality, it's more a coping mode. This group of patients, and I've heard it from, they've reported it to me afterwards as well many times, is if there has a very high healthy adult mode score, often combined with a low vulnerable child score. These tend to be people that are very much in their head. They yeah, sometimes I call them walking heads. They know it, they want to understand it. There's the people that say, "Oh, it's very interesting therapy. Have you got a book for me that I can read and get more knowledge about it?" But they can't really it, live it, or they can't really feel it in their body. So it's a bit like a fake healthy adult. It's a protective mechanism. These also tend to be the co-therapists that you can have in a group. Um, so in this stage, slowly you see that going to the background a bit more, the fake healthy adults, and there's a more genuine healthy adult that they're starting to develop. Um, a lot of it of the schemas, because people with eating disorders tend to have, well, basically score on all the schemas across the whole range. Um, although there's some like emotional neglect. Often they don't score on that high in the questionnaires. Um, but once you get to know the patients, you just don't recognize it. But almost all patients, I would say, tend to score on the schema of emotional neglect and unrelenting standards, like really high standards. That's also a schema that is often um, well that they often have. Um, so in this stage, um, the challenge is to avoid complacency, to keep the group active, emotionally active, and prevent pseudo harmony. I do come across quite often that there's groups where people at this stage start to say they're a bit scared of really having more conflict, or maybe these people that they've come to become to, part in their life that they're valuing, that they are starting to like, knowing their backgrounds, and they don't want to hurt one another, do something wrong. I don't want to make any mistakes. I'm not allowed to make mistakes. I have to be always have to be nice and supportive. And there's pseudo harmony where people will say, "Oh no, well, we are really happy as a group, and we all there's nothing that is irritating, and it's very safe, and I feel free to say anything I want." That always has to be a red flag and needs attention. You want the group to be a place where there's also room for friction from different modes that are clashing in the therapy room. So you can explore the things that they are challenged with in real life outside of the therapy room. Um, so that is one thing. It's also a stage where, as a therapist, explicitly validating the growth that you can see is also very helpful to keep it stimulated, and gives you a tool to steer towards the behavior that you want to see. So the friction, for example, the trying new things, getting out of your comfort zone. I always say, in your comfort zone, you're not going to learn new things. Just step out of it. So learning through also learning through experiential work is also in this stage important. Um, and just stimulating more openness and curiosity. So in this phase, the performing phase or the working and change phase, the group functions as a microcosm, as a laboratory where deep personal change and interpersonal learning can occur. Um, So participants are actively experimenting with new behaviors and perspective. They're engaging in the group in like chair work, imagery, body-focused exercises. Um, it's a very active. The patients themselves are very active, and you as a therapist can lean a bit more backwards compared to the start of the therapy, but they'll still need you very much so. Um, in this stage as well, it's the healthy adult, which is becoming more and more stronger and is strengthened also through the exercises. You might see happy child mode now and then as well occurring, a bit of playfulness in the sessions, genuine playfulness instead of a coping, like I'm being funny and pretending that I'm happy, but I'm actually not. So you tend to in this stage see more real happy child modes occur. Um, Also, the schemas, there's more compassion towards schemas that are activated. There's more insight at this stage. Well, the previous stages already, they've gained a lot of knowledge, insight, understanding of how modes in their case, which modes are activated easily, how they interact, which schemas they have, what triggers them. And in this stage, you also want them to practice with and what's next? What do you do? How can you handle these modes? How can you um, reassure yourself? How can you be more compassionate towards yourself? What do you actually need? What are your needs, the underlying needs, and how can you take care of them? But also the group being a laboratory in this stage. Um, you want them to practice the things, express themselves, do things that they normally would avoid, do that in the group. And gradually in this stage, you also motivated them to more and more also do these things outside of the group in real life with people surrounding them, friends, family, maybe employers, etc. Um, Also, what I've often find in this stage is that you also have to help them pick what are you gonna, what is a good thing to do at this stage. Some people tend to go too slow and still think, oh, I'm not sure if I can do that. I better be careful. You have to stimulate them a bit more. There might be a bit more avoidance in these people. And there's other people where they just want to run straight away. They think, okay, this is the assignment, I have to go. And they'll just, yeah, run before they can walk. So those people, you might just have to slow them down. Um, Often the things that they then tend to do, you can, match them again with their schemas, with their learning history, why they are tackling, even in therapy, tackling things in a certain way. Um, Let me see. Then we go to the next stage already. But before we do that, I just realized there's something I still wanted to mention is to keep the group active and to stimulate all the the challenging each other and practicing with new things and new strategies, especially in eating disorders because they can be quite cognitive and avoid feelings, etc., and avoid real contact with their body, and sometimes also have lost the ability to really connect to their body and to feel certain signs that their body is giving them. Um, I always like to involve a lot of experiential work, a lot of active things, even just start the therapy off with a warming up exercise, but also in debriefing an exercise, doing that in an active way where they have to maybe get up from their chair or um, do a little presentation on something, and everything. All these things help to to see modes still being activated, and you can give straight away can give feedback on them. Um, but also learning by experience is so meaningful and often has a way more long-lasting impression. So specifically with this group of patients with eating disorders, I really like doing the experiential work. And something else that is a large part in this phase is also anger. It's me and my anger again, but it's such an important part in therapy with eating disorders. It's also to help them to make contact with anger, with boundaries that they're feeling inside their body, and to express that in a way that is not geared towards themselves, but outwards. So some people, you get, for some people it's the angry protector. So it's a more open anger that you want them to practice with, to do that in a different way. For some, that's more, I tend to call it the silent bully. So it's a more anger and attack, but then in a more subtle way. And you want them to, in this stage, you see the people transforming, I have to say, from more the angry protector, silent bully towards angry child mode, and also healthy adult, being anger from a healthy adult mode perspective. So I think that is well, we tend to spend quite a few sessions on these topics on anger, and yeah, spending a lot of time addressing this and practicing it in a different way. So now we really go to the next stage. So the adjourning or termination phase, this is the phase where you go towards the end of the therapy, and well, the group members have to process loss, reflect on what they have learned, on what the therapy has meant to them. And sometimes it's a process of grief, and not just uh, grief of that you're going to say goodbye to people that you've come to care about, but also for looking back and realizing, what has the eating disorder, what has that meant in my life, what have I lost there, um, and on an emotional level, what have I felt and experienced with this group that maybe I've never experienced before, which is also a really sad realization, that can mean there's room that they needed for to grieve that as well, that what they missed in life. You also see sometimes that old coping patterns suddenly emerge again, that the eating disorder pops up again, that suddenly food restrictions or control behaviors are activated, which can also cause anxiety. Like, am I ready to stop this therapy? Can I do it on my own? Can I do it without the group? Um, so feelings of abandonment, fear, shame are all very normal in this during this stage. So if we look at the modes, you see vulnerable child, abandoned child, but also healthy adults. Like, I'm really scared, but I also know that this is good. I'm ready to stop. I need to move on and do it in real life, and move forward again with my life. So typical schemas that can be activated during this stage are abandonment, emotional deprivation, effectiveness, shame. And as a therapist, it's well, your task to address the grief, the feelings of anxiety, and to stimulate, to not avoid saying goodbye, to not avoid all of these feelings, um, to openly reflect together on what has the group meant, what has therapy meant for you, what have you accomplished, also celebrate what went well and how far you've come, and also discuss what were you hoping on accomplishing, and maybe you haven't accomplished that just yet, or only part of it, and how does that make you feel? Um, so often during this stage, there is a lot of mutual support as well. And groups often have rituals on how to say goodbye. And it's really helpful for a group to, if they don't come up with their own ritual that they want to do, to provide them a ritual. And not overdo it, but something simple like writing a card for each person in the group with a personal message on it. And well, basically, it's the last stage of the group therapy. After this, yeah, everyone goes their separate ways. And I'd like to, in a minute, do a little exercise, take you on a little exercise to also have the experience on how is it as a patient to go through group therapy. Okay, I'd like to do a little exercise with you now. We're going to take a little journey. For that, I'd like to ask you to please sit comfortably on your chair with both feet resting on the ground. Keep your back upright but relaxed. And softly close your eyes. Now bring your attention to your breathing. Notice where in your body you feel your breath most clearly. Maybe in your chest, your abdomen, or around your nose. There's no need to change anything. Just breathe in and out, all at your own pace. Now imagine that you're struggling with an eating disorder. Perhaps anorexia, bulimia, or maybe binge eating disorder. Choose the one that's most familiar to you. The one that maybe, well, you might recognize parts of it in yourself, in your own eating habits, or the dynamic that it has. So just take your time to imagine that you're struggling with such a serious eating disorder. And your difficulties have become serious enough, and you seek help. Your general practitioner refers you to a specialized eating disorder clinic. And there you are invited to join a schema-focused group therapy program. A group for people who share similar struggles. Now imagine yourself walking into the therapy room for the very first time. The therapists are already there, greeting you with warmth. And other patients are arriving, one by one, finding their seats. You look around the room, faces you don't know yet. Now notice what's happening inside of you. What are you feeling? Perhaps your body feels tense, or your breathing becomes shallow. Maybe you wonder, do I belong here? Am I sick enough? You're scanning the people in the room, looking at their bodies, and wondering, how can I sit? How do I position myself on this chair? How can I position myself in a way that people don't really notice how fat I am, how big I am? You might feel a desire to hide your body or make yourself smaller. Just simply observe what arises. Feelings, images, thoughts. and allow them to be there without any judgment. Now move forward in time to around the third session. The group has started to get to know each other. People are beginning to share more openly, not only what feels safe, but also what feels uncomfortable. The group starts to discuss things that they don't like about therapy, things they find annoying, things that they don't like about each other. Imagine that the conversation becomes more intense. The atmosphere is a bit more charged. There are moments of friction, even conflict. Just notice how this affects you. What do you feel in your body? Make another jump in time. Gradually, something has shifted. You feel more comfortable sharing your experiences. There is more trust, and you've begun to understand each other's patterns and sensitivities. Sharing with the group has also become less scary. Now imagine that you have an open session where you share with each other, where you confront each other, a session where you stimulate each other, and you're making progress already. It's tough. It isn't easy. But while you continue with your sessions, you're starting to change. And you also notice that some eating disorder behaviors and eating disorder thoughts are becoming less prominent. Emotionally, it's still a roller coaster, but it's more manageable. You can breathe through the difficult moments. You also notice that some things take more work, more time, take a longer and slower process of change. Take a moment to sense that inner movement, however small, that comes with change and growth. Just notice where in your body you can feel that and how that makes you feel. Now move to the final two sessions. You and your group are preparing to say goodbye. Saying goodbye to the group members. And also saying goodbye to the therapists. You've shared very personal information and very vulnerable experiences together. Tough times, also nice things. But now's the time to each go your separate ways again. Imagine reflecting on the journey you've made together. You might feel gratitude, sadness, or even anxiety about what comes next. Some parts of you have changed for the better. some parts perhaps need some more time. Maybe you didn't accomplish everything you hoped for at the start. Maybe the world around you hasn't changed as much as you have, which might bring new challenges altogether. How does that feel? How does it make you feel? Feel what it's like to say goodbye, to close this chapter while carrying the learning forward into your life. To carry your achievements while still being faced by challenges as well. Now you're saying goodbye to the therapy, the therapist. You start to live your life. Hopefully with a lot less eating disorder. Feeling a lot more competent than you did at the start. Feeling more equipped for life. But not perfect. Now slowly bring your attention back to your breathing. Notice again where you feel your breath in your body. Inhale deeply and exhale slowly. I'll count to 3, and at 3 you can open your eyes. 1, 2, 3. Please open your eyes, look around, maybe stretch your body a little, and become aware of your surroundings again. So we've come to the end. I hope you enjoyed this brief video. I'll just put one last slide on where you can find my contact details. So if you want the information that I shared with you today, just send me an email and I will get back to you. Bye.